is Raibe, and I'm one of the medical assistants here at Bellissimo Medical in Western Florida. Today we're going to be talking about intimacy wellness, which is a crucial component of human health and happiness, and also to build a strong relationships and for family stability. We are fortunate to live in an area which offers a lot of options to solve these problems, and we believe that functional medicine is the right approach to help in these issues and also to solve the root of those problems. I'm here with Stephanie Nerette, who is an experienced nurse practitioner and is also the owner, along with her husband, Dr. Jean-Claude Nerette, at Bellissimo Medical. So, Stephanie, please tell me a little bit about your experience and your qualifications.
Thank you, Raibe. Raibe, I'm a nurse practitioner, as you stated, and I've been doing functional medicine for over 15 years here in Weston, and we've been specializing as well in intimacy wellness.
Can you please explain the difference between the functional medicine and the traditional medicine related to the treatment of these intimacy problems?
So as far as functional medicine is concerned, what we try to do is we try to get down to the root of the issue. We don't do chronic care management as far as like putting a Band-Aid on things. We try to fix things, and especially with the functional medicine approach with intimacy wellness, we get down to the root of the problem, whether it be hormonal imbalances that we treat, whether it be actually giving platelet-rich plasma to help grow collagen and actually new blood vessel formation, or we also do laser treatments that actually cause repairing and remodeling through heat, as far as with the vagina as well.
So tell me a little more about those procedures. I've heard that there's different type of procedures that we can perform in order to better help. And I also, as you mentioned, about the hormones replacement therapy, how they can affect positively to those problems.
So one of the biggest complaints that I have clients come into the office is telling me that they have no libido, especially after pregnancy. It seems like the hormones just never reset, where they're really not interested anymore. And that's really, really horrible for the relationship, and that's crucial for a marriage. So what we do is we look at these items and we see where the imbalances are, and we correct those imbalances. So everybody's different. It could be testosterone's low, it could be estrogen, it could be progesterone. There's many different things that we look at to see where the imbalance has taken place, and we actually introduce those things back. More importantly, though, we also have other treatments that are non-hormone related, such as the one that we talked about earlier about PRP, and also with the laser. 1 in 25 women experience urinary incontinence, which is huge, after the age of 18. So this is not just a perimenopausal treatment. This is not a menopausal treatment. This is for kids as young as 18 years old and older, as far as different treatments such as PRP that help with urinary incontinence, and also the laser treatments such as the CO2 RE enema. Obviously, as you know, how devastating that would be to women as far as having urinary leakage, whether it's having to wear a pad when they go work out because they're too afraid of doing exercise at the gym, or even in intimacy of having that urinary leakage. So the great news is that we have fantastic treatments here that can help out with those issues.
So are those procedures painful? Tell me a little bit about those. The PRP that you mentioned, is that injectable? There's something that can be restricted to doing afterwards?
So both of these procedures are non-surgical procedures, minimally invasive. They're very little discomfort for both of the procedures. We prep our clients with numbing cream prior. Such as the PRP adds an awesome benefit because unlike the laser, it actually intensifies orgasms as well, which is an awesome benefit to our clients.
And is there any restriction after each procedure? Anything that the patient needs to be away from after doing this type of treatment?
So with the PRP, there is no restriction post procedure. You can actually go to work the same day. We actually encourage sexual relations later on that evening with your partner. So there is no restrictions for PRP. Now for the laser, the restriction is for 5 days after the treatment. Essentially nothing goes in the vagina. Otherwise, regular activities such as exercise, there's no restrictions on that.
So I heard it's not only the platelets-rich plasma or PRP that we can inject in the area, but we have other things that we can use to enhance the results. I heard about Libido Boost and Libido Max Plus here in the office, so can you?
That is correct. So Libido Boost essentially uses your own blood, which has platelet-rich plasma, and it has the growth factors within to cause the repair. Now, with the Libido Max Plus, we offer the additional benefit of utilizing stem cells, which are essentially from the placenta, non-aborted fetuses, that we're actually able to retrieve those stem cells, and so they're younger stem cells, so they work a lot more effective.
Well, I think these are most of the common questions from patients. Thank you, Stephanie, for your answer. And if you have more questions about this type of treatment or intimacy wellness at all, feel free to come to our office or give us a call to schedule a free consultation with Stephanie or Dr. Nerette. We are more than happy to receive you here in our clinic.